Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies for your journey to optimal health in life and in your business. Now, today's episode is going to be extremely exciting because we have a very interesting guest, Rita Brewer, and she is a diabetes reversal coach. I cannot wait to hear how she does this for her clients. But before we dig in, a quick message from our sponsor, Grow Solutions. We help transform passionate healthcare practitioners into profitable practice owners without overwhelm or guesswork. We do the best we can to eliminate your biggest headaches, whether that's finding you new patients or clients, helping you with patient communication. Maybe you've got some operational chaos. We've got proven systems and frameworks to help with this. And of course, yes, we are implementing AI systems with our clients so you can enjoy life and practice too. So we're not just an agency or a vendor. We are a true growth partner with you. So if you've ever said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can help you with that. Drop the word grow in below, or feel free to reach out to me on any of our social platforms. But let's get to the guest that you are excited to be here to hear and see today. Rita Brewer is a physician associate, passionate educator, and advocate for lifestyle-driven healthcare. With over 33 years of experience spanning internal medicine, surgery, obesity, and integrative and lifestyle medicine, she has dedicated her career to transforming lives through the power of preventative care and holistic healing. She has earned her Bachelor of Science in Biology from the State University of New York at Geneseo. And Geneseo, excuse me, thank
no
you.
Problem. Everyone messes that up.
Completing her clinical training at Weill Cornell Surgical Physician Associate Program in New York City. Rita is a distinguished fellow at the American Academy of Physician Associates, a certified diplomat in the American College of Lifestyle Medicine, and a trained functional medicine practitioner. So there will be nothing I can pull over her today. Now, over the years, Rita has practiced in hospitals, outpatient clinics, and private practices, caring for thousands of patients living with devastating effects of uncontrolled type 2 diabetes. Now, through the work, she's discovered her true mission to educate and empower people with the truth that diabetes and many other chronic illnesses are not only preventable, but irreversible. She went to create the Diabetes Reversal Formula, a comprehensive coaching program designed to help clients reduce medications, normalize blood sugars, lose weight, and reclaim vibrant health. Rita is also the founder of the Healthy Lifestyle Ministry at Raleigh North Christian Center, where she merges her clinical expertise with her deep passion for faith and community. I'd love to hear more about that. Through this ministry, she inspires and equips individuals to take ownership of their health, body, mind, and spirit. Her greatest joy comes from walking alongside patients and clients that are experiencing transformation, not just in how they look and feel, but in their ability to overcome illnesses, reduce or eliminate medications, and lead fuller, longer lives. So Rita, welcome to the Prime Health Podcast.
Thank you so much, Derek. I'm happy to be here.
Absolutely. So you've got a 33-year storied history in healthcare, so I commend you for that. That's a very tough thing to do, to stay in it.
Yeah.
But before you started, was there a moment or a personal life experience that said, you know what, I want to go into healthcare myself?
Yes, actually, as a young child, even elementary school, it's the only thing I ever wanted to do. I was like dissecting insects in my backyard as a child. I remember we had to write an autobiography in 5th grade, and I talked about wanting to be a nurse because, growing up in the 60s, or I was maybe early 70s then, I didn't know that I could go any further than a nurse. But I knew I wanted something in the medical field. It's always been that way. Yeah, it was the only thing.
So you've been a physician associate that whole entire time?
Yes, right after I went straight from college to PA school. So yeah, I graduated PA school when I was 24.
Well, congratulations.
Yeah,
long
thanks.
time ago.
Yeah.
So what's your unique approach? I know you have a formula I think that you went through, but what's your unique approach to specifically reversing diabetes, type 2 specifically?
Yeah, well, I mainly focus on, there's 6 pillars of lifestyle medicine, which we use to treat and prevent chronic illness like diabetes. I've thrown in a seventh one that I think is important, and number one, which is mindset. Because we've got to have the right mindset to believe that we have the ability and capability to achieve and heal the way our bodies are designed to. So I work with that. I work with mindset. We have to work with so many factors when it comes to lifestyle change. Nutrition is a big one, physical activity, stress reduction, good quality sleep, reducing toxic and avoiding those substances, and community support, and support relationships. So those are 6 pillars of lifestyle medicine plus the mindset. So when I work with people to reverse their diabetes or any other chronic illness or lose weight, we really got to dive into all of them because they all play a role in their success. So we take a deep dive into all of those areas.
Okay. So of those 7 points that you've been, practicing with for quite a while with your patients and your clients, when you say you're able to help reverse diabetes, what's the misconception, or I guess say maybe even the pushback that you get from people that say, well, that's not possible?
Well, I don't usually get pushback from patients. I get that eyes wide open, like, what do you mean? No one's ever told me that before, so they're like, really? Is that really possible? Because they want that, right? So that's been my frustration with our conventional medical model, right? Because when you have a diabetes, first of all, you don't even do anything until you get a diabetes diagnosis most of the time, right? So people can be pre-diabetic for years and just be told, well, just watch your diet, eat less, move more, and that's it. They're not giving any tools for success. So it's like there's a fire in the oven that's already started and nobody's getting out the fire extinguisher because, well, we'll just wait until it's full-blown diabetes, and then you get medication and a statin, and, other diabetes drugs. And that's how we manage it. And yes, there's, it's taught, yes, you need to change your lifestyle and you need to eat healthier and exercise more, but we don't give enough of the tools for success. And the practitioners, doctors, nurses, PAs, we can't help people with those tools because we're not taught that in our training programs. We have very little nutrition experience. It's certainly not exercise physiology or, any of that. It's now starting to come more and more. Some training programs and residencies and fellowships are incorporating lifestyle medicine now that it's been around for 20 years, but it's still not every day. You don't see a lifestyle medicine clinic on every corner, right? You have primary care. So, I think I got off track. I forgot what the original question was.
No, you answered them all. So that leads me to a question. So somebody realizes that they have type 2 diabetes, or they think that they do, they're not sure. Can you tell me the potential 2 different approaches that are taken? If they do go into the typical, which they go into is a primary care physician's office, what can you do as a doctor? I have type 2 diabetes. Or they come into your practice. Rita, what can you do? I have type 2 diabetes. Can you give us the difference in how that patient would be treated?
Sure. In conventional medicine, and when I did primary care for many years, we would tell them, you got to eat healthier, you have to exercise, but here are the prescriptions that you need in order to keep your diabetes under control. We'll monitor your blood work once every 3 months, and it's basically just kind of managing or maintaining. It's never taught that, you don't have to be diabetic at all. This is a lifestyle related condition that can be reversed. That is not taught in conventional medicine. And that's why I love to open people's eyes and say, this is what's possible. When I see somebody who comes to me in a lifestyle medicine clinic and they're, morbidly obese, and I know that we can turn their lifestyle around. We can normalize their cholesterol numbers and their blood pressure and their weight and their blood sugars, and all of that is possible. And when people really want that, they get excited, and then they're on board for the journey. But then there are other patients who are just like, I want to just eat what I want and I'll just take the medication. And there are people that are like that. So, my
Yeah.
job is just try to meet the people where they are, see what changes they are willing to make, and then, help them to do that. But yeah, I got to say, I do get a little frustrated because I say, no, you got to do more because you don't have to take this medication. But people
Yeah.
are going to do what they're willing to do. So I have to meet them
Yeah.
where they are.
And that's probably why you created the seventh pillar when it comes to mindset, because if
Yes.
they're not willing to make a change, do you like your candy and your cheeseburger and your chocolate shakes, which I love all of them,
Yeah.
but you have to make a decision. It's delayed gratification. Do you
Hmm.
want to be healthier now or healthier later?
Right.
So it's good that, the mindset is a strong piece of it. I mean, like, how do you overcome some of the people that have a mind? Like, can you overcome that when people are like, I just don't know if I want to give up, my donuts? Like, how do you help them overcome that?
Well, when I work with my coaching clients, this is a conversation that we have to have right up front. Like, this is what, if you truly want the transformation, the full transformation, if you want to reverse this diabetes completely and be completely successful, there are certain things that you have to limit, and you have to move your body, you have to walk, or you have to do some sort of resistance training. And I have that conversation with them when we do like a free strategy call to say, these are the things that are going to be required. I need to know what you're eating. If you have to share that with me, because I can't help you. There's never judgment about what you're eating. If you're eating Pop-Tarts every day, fine, tell me, because then I know where we're starting from, right? And what changes we can make. But I have to know if they are willing, ready, and able to make those changes before I'll work with them as a coach. Because if they're not willing to do, what needs to be done for it to be successful, then, we're not the right fit.
Yeah. Rita, are you mainly in your business, are you mainly attracting people that are online, or do you do physical location work as well?
My coaching is all virtual. Yep.
Okay.
Hmm.
Okay. Wonderful. And we'll always share your links for people that can learn about how you're doing that. So
Sure.
what I think is great is in lifestyle medicine and management, as it's getting, into the public's eyesight more and sound sight, they're hearing more about it.
Hmm.
People are probably looking for you more often. Have you seen an uptick in people searching for services like yours?
Yes, absolutely. And I do practice under my PA license in a lifestyle and obesity medicine clinic as well. It's not my own, but I am employed there. So we do have, patients that find us online when they're looking for something like that. But we also have quite a big referral base from local primary care doctors and OBGYNs who know their patients need this kind of help, but they just don't have the time or the knowledge to be able to give it to them themselves. And that's all we do. This is what we specialize in.
Okay. All right. So can you maybe go into a little bit more detail, specifically on what your diabetes reversal formula is and how that can work? If I had type 2 diabetes, how would your formula help me?
Yeah, well, like I said, we're going to dive into every single one of those pillars. Some people, nutrition may be the biggest issue that they have. Other people are eating fairly clean and well, but they're not moving their bodies at all. So we need to
Mhm.
design a movement program for them. I, have some people who come and, they have all kinds of gut health issues and inflammation. So we need to address those things. With the functional medicine background, also can support them in, more of the deep dive functional medicine testing if it's needed. But I really believe, in functional medicine, we have to start with the foundations, right? It's all the basic stuff. I have a lot of people who will eat a great diet and they're exercising all the time, but their stress is so high all day, every day. You can't normalize your blood sugar that way. So, I mean, I really have to, the coaching, when we meet each time and I get to know them, I do like an hour and a half consultation with them on the very first visit. It's a very comprehensive medical and lifestyle intake form. So I know what their current habits are, to see where are the biggest, areas that we'll need to focus on for that person. And it's not one program. Here's my food plan. Here's my fitness plan. Everybody gets the same thing, because that doesn't work, right? We're all individual. We all have different preferences and, likes and dislikes with food and fitness and things like that. So everything I do is customized for that individual to try to make them as successful as possible.
Yeah. And in a typical office that you used to work in, I guess you still do work in sometimes, which is great.
Mhm.
You'll do blood draws on patients. With your virtual practice, are you suggesting them to do blood draws as well to get deeper diagnostic details?
Sure. Well, what I start out with first is when I do the initial consultation, I like to work with them with what they've already have, right? So if you're going to your primary care doctor and you get your annual physical and your annual labs, or if you had any other x-rays or issues or anything like that, I say, give me the reports, along with your initial consultation paperwork so I can review all of that and then look at that more, deep dive approach. So I try to save them as much money as possible. If you've already got labs through your insurance, let's look at it, and look at it from a functional lens and see, what we can optimize, right? Are your vitamin levels optimized, right? Or, in conventional medicine, we only treat things that are way outside of the normal range, right? Whereas functional medicine, we want to look at optimal ranges. So it may still be in the normal range, but it's something in the very low end that you want to be more on the higher end. So like B vitamins and stuff, which are so important, for cellular energy function, right? Our electron transport chain and ATP production. So we need to have B vitamins in our diet, and some of us may need supplements. So yeah, I do all of that. But we start with all the foundational things of those 7 pillars. And then if we need to dive deeper, like somebody came to me, they just wanted to lose 10 pounds. Turned out she had celiac disease. So I had to send her for gut testing and seeing what was really going on. And as it turned out, she had celiac disease. So, that's a nice thing about being a PA and a coach, so I have that years of medical background. So I bring that to the table as well, even though I'm not taking over as their medical provider, but I can see things as a provider and then say, this is what I want you to go talk to your doctor about or your provider about. And give them those light bulbs. Or I've had a diabetic patient too. He's been diabetic for 10 years and sees an endocrinologist, and he's never once mentioned, have you ever tried a continuous glucose monitor? Little simple things like that. It's like, those are so valuable. How do you improve your diabetes and reduce your insulin if you don't know what your blood sugars are doing besides just one morning finger stick, right? So
Oh my.
I love using continuous glucose monitors, even for people who are just trying to lose weight who don't have any pre-diabetes or diabetes, because when you know what's going on with your blood sugar, that's going to really help you manage your weight better. And your cholesterol and blood pressure and all that is affected by, poor metabolic health and poor glucose processing.
So Rita, an easy but difficult question is, how bad is sugar for us?
Well, all carbohydrates are sugars, right? So vegetables are sugars, fruits are sugars. So when they're whole natural foods that come from nature, they're not bad for us. It's all the processed chemical laden sugars that, we have to worry about. And that, probably, what 70% of what's in the grocery store is all that, processed carbohydrates and seed oils and, chemical laden frankenfoods, right? So, but the real whole foods that come from nature, like vegetables and fruits, are good carbohydrates. But yes, if somebody has diabetic, I do have to, inform them about, fruit, because it can cause a lot of blood sugar spikes. But again, we manage it, individually. Everybody is different.
Yeah, you bring that. It's interesting. My son and I had a conversation. We did a FaceTime call last night, and he said, "Dad, this is the first time I kind of went to a grocery store. He's shopping for himself. He does pretty good as far as being a healthy shopper. He's an athlete." And he said, "I sat in the produce department. I was just looking at people that were in there." And he goes, "I just cannot believe how many people are unhealthy, and they have healthy choices in front of them, but they go to the end cap and they'll buy the chips and they'll buy the soda and they'll buy the candy." And he goes, "And the worst part is you see mom and dad who are a little bigger on the heavier side." And he goes, "And then you see their kids that are 10 or younger, and they're already put at a disadvantage from that." So I thought it was interesting. He wasn't picking on the people. It was just an object. He goes, "I haven't done that, just sitting there like I was in an airport.
Yeah.
But I just watched for a while." So it's unfortunate. Too many, like, you're needed. People need to understand that. And the
Yeah.
mindset there is got to be so hard, because that mom and dad, for instance, that have the daughter or son that's bigger already, they just don't think, they're like, it's okay. I'm okay. I feel okay. Problem. Meanwhile, their sugar spikes are so bad and their hemoglobin A1C is through the roof.
Yeah.
It's unfortunate.
And I think the number's around 21% now of our children are obese. I mean, the numbers just keep climbing every year. Right now, like 75% of the population, 42% are obese. The children are obese. We have chronic illness, liver disease and liver transplants, in children, heart disease, high cholesterol. Pediatricians have to now treat high blood pressure and high cholesterol and diabetes in children, which they never had to do before.
Mhm.
So yeah, it breaks my heart, but you could tell a lot about a person by what's in their grocery cart for sure.
Yes.
Yeah.
That's why I don't shop with my wife. I take my own card, I get the candy, I get the other. I don't, but I wish I did back in the day.
Yeah, again, balance, right? We got to find, I do that with my clients too. I say, hey, I love chocolate, but I'm going to tell you which is a better chocolate than the one that you're currently eating, and moderation for different things.
Yeah. So for the potential patient that's watching this or listening this and like, what, I don't know if I'm a type 2 diabetic or not. I'm a little overweight. What are some potential signs and symptoms that they should be aware of that are saying, what, Rita said this, maybe I need to reach out to Rita to get some help?
Mm-hmm. Yeah, well, definitely if you are overweight or if you're in the obese category, your risks for having diabetes are much higher than the average person. If you have it in your family, and your risks are higher, your age increases, that as well. But you want to ask your primary care provider to check your blood tests. And if you're going for your annual physicals, they're usually going to check your hemoglobin A1C, which is a long-acting blood sugar test. This gives us a 3-month average of how your blood sugar has been, which is a great tool to evaluate for that, versus just a fasting finger stick that just tells us what your sugar is in that moment of time. So that you definitely want to know your numbers, know what your A1C is. And I had so many people come to me, because they want to lose weight. And I was like, well, what about your A1C? Has that ever? Yeah, I think it's like, 6.5 or so. And I'm like, that's diabetic. Did anybody ever tell you that was diabetic? No, I didn't know that. And that just breaks my heart. It's like, how could you not know? How could you not tell your patient that, and do something about it? Let's get, be proactive.
Yeah. Yeah. Well, thanks for sharing those. Those are great. From a business perspective, your personal business, what's the focus on in your business right now? What are you trying to do in your business?
I love one-on-one coaching. I love meeting with people just like we are on Zoom. That's how I do my coaching calls. And I just love those aha moments, when you see that person light up and that something connected and they're ready to make that change. And then they see the results and they come back the next time. It's like, oh my gosh, I lost 2 pounds. I couldn't lose 2 pounds in forever. That's what I love. And that's really what I promote is my one-on-one coaching. And then otherwise I just get out there, like I said, doing podcasts, talking in the community, doing health fairs, speaking engagements. I have a medical conference I'm speaking at this weekend on metabolic health and and lifestyle medicine for the prevention and treatment of metabolic health disorders. So just getting out there in the community, and whoever wants to learn about this topic, I'm going to talk to them because it's so needed. It's not being talked about enough. It's getting, more and more attention because the numbers just keep getting worse and worse, right? America, we have most sophisticated technology in the world, right? And we have the sickest people. And that's a crime to me. So, I got to get out there and tell people.
Yeah. Good for you. The grind and the hustle.
Yeah.
After 33.
Yeah. It's a passion that just won't die.
Yeah, good for you.
That's
Good for you.
my assignment on this world.
Yeah.
Mhm.
Right. What challenge is your business facing right now as you go through it?
Well, I think getting the right people to find me. That's why, I like doing podcasts and speaking to different people to get connected with different audiences. And finding, some of those people who are really committed to and motivated to want to make that transformation.
Mm-hmm.
Yeah.
Love it. So from an expectation standpoint, I'm a type 2 diabetic. I'm not, let's say I'm I reach out to you, I'm overweight, 50 pounds. My hemoglobin A1C is 7.7. I'm struggling a little bit. Can you give us, and it's difficult because you said everybody is unique, but can you give us kind of an expectation on how I can expect results?
Sure. Well, first of all, if somebody's in that exact situation you just mentioned, I want to make sure they actually do have a primary care doctor, because I'm not going to, take on that role. You still have to have a primary care provider. And if your A1C is 7, you need to be on a diabetes medication. So if they're not already, I'm going to tell them, go see your doctor. I will work with you to make this transformation so eventually we can get you off it. But for right now, I want to make sure that you're being treated appropriately. Same thing for like high blood pressure. If somebody says, or statins, I don't want to be on this medicine. It's like, okay, we'll just keep it for now. But as we gradually get healthier, then you can talk to your doctor about, making those transitions. But I'm sorry, I got off track. What was that? The question you said again was
Expectations.
expectations. So they have to work on their nutrition. There's no question. They have to share with me what they're eating. There's an app that I love, that is for, we need to put you on a low sugar diet. There's no question about that.
Okay.
How strict that is going to depend on the individual. Some people can do a ketogenic diet, which is very low carbohydrate for, a period of time. Some people find that too rigorous, and we need to customize it a little bit and modify that a little bit more. But I want to teach them where the hidden sugars are lying, because that's what a lot of people don't realize. Sugar is in so many things that people don't even realize. So I give them handouts and educate them about that and help them with dining out, right? People are busy. They're always on the move. They're traveling. So they have dining out guides of like, when you're out and you're traveling, if you want an Indian food or Italian food or Mexican food, what are the best options to go for? So I just want to, bring them all the tools for success, that they need. Yeah.
Yeah. Well, thank you for sharing that. I do appreciate it. So we covered some like expectations.
Yeah.
Can you share a success story that you've had with a client that you work with?
Yeah. Let's see which one. I could share a story about my husband, actually, which I talk about in my webinar that I do. My husband, was a typical African-American guy who hates to go to the doctor, would never go for any primary care, support services, whatever. He's in his 60s and never going to the doctor. But he said, he wanted to lose little bit of weight. And of course, even though that's my expertise, he wanted nothing to do with what I had to say. And I get like a typical man, I'm going to do it my way. So I was like, okay, right. You do your thing. But all of a sudden, like, it just kind of was weird. Like, it seemed like over such a short period of time, like all of a sudden his muscle mass was going away. I was like, what is going on? Like, it's like, well, he was a very big, bulky, muscular guy. And all of a sudden, like, his muscles was shrinking. I was like, what is going on here? It just seemed like it happened overnight. I was like, you got to get in with the doctor. I was afraid he had cancer. And we finally got him in to see somebody. And his blood sugar was 495. So he was clearly very diabetic, but, and he was coming home. He was working and active, and he would come home from work and be very tired. But I was like, well, he's in his 60s. I don't know. Maybe this is what 60 looks like, because I'm not there yet, right? But so bottom line is, yeah, his A1C was extremely high, and he had to end up going to the emergency room and getting on insulin. And I was like, how did this even happen? I was like, I cook healthy. We don't have sugar and soda in the house. And how did this even happen? Turns out he had, free sodas and all the junk food at work that he could want. So he was indulging in all of it. And he was ready, that scared him, and that he had to be on insulin, but he was ready to make the change. And he dropped that soda and junk food and got more serious and started exercising. And within 4 months, we got his A1C down to normal with no insulin at all. Like, and that's pretty challenging, right? Because usually if you go from insulin to an oral medication but it was just like nothing. And and he did amazing. And then he got his muscle mass back. So yeah, he didn't happen to mention that he was thirsty all the time and peeing all the time, which are symptoms of diabetes too. But he never mentioned it. So yeah, that's just one of many, and there's millions of people like that, and it's totally doable. But there's so many other things that get better. That's what I love working with, helping people with weight loss. And that's where I really got started, is working in a weight loss clinic. And I saw that people, not only did they lose weight and get their sexy swag back and feel good about themselves, but their cholesterol got better, their blood pressure, their diabetes, their fatigue, their joint pains, their energy levels, their hormonal imbalances, heavy menstrual cycles. All of that stuff gets better with improved metabolic health. So just changing our lifestyle, they say at least 85% of what people go to their primary care doctors for, these chronic conditions are lifestyle related. So that's what fueled my passion, is when I saw all this happening in the weight loss clinic. I was like, why is this not primary care medicine? This is what we should be doing in every primary care office. And we're still not there yet. So that's why I was like, I got to go outside the medical model, because, I'm 34 years in. How much more can I take? Is like, I got to go outside and talk in the community and teach in my church and, educate other people who, want the tools for success to start doing it now, instead of waiting until our healthcare system changes and gets on board with all of it.
Very true. Very true. Well, I'm glad for your sake and your husband's that you helped him and that he listened.
Yes.
That was probably the hardest part, for him to listen.
Yes.
I can tell you, from my husband to my wife, fall short on that often. So Rita, my next question would be what do you feel, as a physician associate that's also a lifestyle medicine individual, and you do health coaching, what do you feel that you do better than anyone else that's out there?
It's a holistic approach. Number one, I love people. I love talking to people. A lot of healthcare providers, I don't want to talk too much. Let me just get in and out. But I really genuinely love people. I love talking to them. I love listening to them. I love hearing what their concerns are. And then I take a holistic approach, which we don't get to do enough in conventional medicine. And that's what always frustrates me so much. You got this 20-minute appointment, tons of charting that you have to do, and you can't be really effective with helping anybody transform anything in such a short period of time. So I get to spend more time with people when I coach them, so we can really dive into what those little, nuances are of their specific challenges and barriers are, to really find out what they are and dive in to the nitty gritty of getting those things better. And then I think, like I said, as a coach, I'm also coming in and bringing, number one, I've had many, many years of therapy myself. So I bring the emotional support in. A lot of my clients or patients say, I feel like I just had a therapy session with you. I was like, yeah, I've had a lot of experience with that. So for my own, but, and then, bringing in 34 years of medical, surgical, experience, to, my knowledge. So my last client who just came to me for weight loss, she was also dealing with, severe incontinence and orthopedic issues, arthritis and varicose veins and lymphedema. And, I got her in the right direction to help get her, seeing all the right specialists for those things, but that nobody ever told her to do before. So,
yeah. You're doing godly work, because I know that's part of your doing mission work, and that's good. Because most people just don't know. They really don't.
Yeah.
So you had mentioned before you do a webinar. So can you tell us a little bit about the webinar that you offer?
Sure. It's called my diabetes reversal formula. And if you're interested in my next one, you can just send me an email. All my contact information is on my website, ritabrewer.com. Just email me webinar, and I'll let you know when my next one is going to be. But we basically just talk about my perspective, which I shared a lot about today, about my passion for this. And my very first PA job was actually in vascular surgery. So that's where I saw all of the end stage complications of diabetes, the worst of the worst, the amputations and the strokes from carotid artery blockages and dialysis patients. So just talk about my experience and how that really impacted me. And then we talk about the statistics of obesity and diabetes and why this is so important. We get into how to balance blood sugars, where those hidden sugars are, knowing your numbers, what are the appropriate ranges that they should be. We get into, like I said, those seven pillars of lifestyle medicine and why they're so important. So it's real education, about diabetes and the fact that it is reversible, and the fact that our medical community doesn't talk about that. And we really just focus on, medication, and not enough on the tools and strategies to be able to improve that. Because these are all chronic conditions like this. They're just, they're pacified with medications, right? You don't really reverse anything. You're just, keeping it stable. But the chronic diseases just always get worse. So medications don't prevent them from getting escalating. They just, the lifestyle changes are what will actually reverse cardiovascular disease, diabetes, all that.
And sometimes the secondary effects of the medication don't always help either.
Right.
It's a hard part of what you do in healthcare with that.
Right.
So what is your vision for your business in the next 3 to 5 years?
Okay. Well, then I would love to be able to, let me see, 3 to 5 years. I would like to be strictly doing virtual coaching. And not be practicing conventional medicine anymore, because, like I said, I do have burnout. I will admit to that from our system. It's very difficult to work in. It's a very stressful environment, and mostly because of the time constraints and dealing with insurance companies and all that kind of stuff. So I would love to be just doing coaching. And I just love, at this point in my life, I feel like I deserve to make my own schedule and work when I want to work. And I love to travel. So I want to be able to travel more and not be tied to a clinic. So I can do my coaching from anywhere. I can still go on vacation and still be a coach.
Absolutely. Yeah. And why not be on the Mediterranean telling somebody how to live a healthier lifestyle?
Amen. I'm going to be in some side cafe in Italy and doing some coaching.
And eating the bread, because you can eat the bread in Italy more than you can eat the bread.
That's right. Yes, absolutely.
So Rita, I will share all of your links for people to be able to your website, if you have a link that they can learn more about the webinar. But if people wanted to, like what they've heard today, if they want to learn more about you, want to learn about your diabetes reversal formula, where would you like to send them to learn more?
Just come to my website, ritabrewer.com. You can get on my email list there where I send free health content and information all the time. You'll know, when my next webinar is. All my social media links are there as well. Follow me on social and you can see what I've got going on in the community and wherever else around the world if I get there too. Just feel free to ask me questions. Send me an email. I have a free download on my website too. The three quick tips to improve your diabetes today. So get that free tip, download that, and I'd love to hear from you.
Okay. 2 last questions here about health for people.
Mm-hmm.
So if you give one piece of advice for anybody, not necessarily a type 2 diabetic, but anybody that's out there, which of course will help the type 2 diabetics, but one piece of advice that could help everyone's health in a positive way.
Food is the most important medicine that you can possibly take. There's people today that are on 15 drugs a day, and that's commonplace in medicine, but there is no better medication that anybody could take for any chronic condition than, I'm not saying don't take your medicine, but I'm saying the best medicine is the food that you eat, because everything that you put on the end of your fork is either feeding good health or it's feeding disease.
Okay.
We've got to get away from all the processed chemical-laden junk. And I know it's hard because our culture is filled with it. It's everywhere. But when you become aware, of where these, toxic foods are, it makes it easier to avoid.
I love that. Thanks for sharing. So that tells me I should no longer eat my Snickers bar with a fork. I don't. I haven't for a long time. But last question for you, Rita, because I really appreciate your time. You're on the Prime Health podcast. I always ask guests, what's your definition of Prime Health?
To me, prime health, and I think anybody who's aging, and I'm approaching 60, we want to have quality of life, right? It's not just about, not taking a medication or avoiding a disease, but we want to be able to do the things that we want to do in life. Like I love to travel and I want to hike and I want to, explore, and I want to prime health to me is being healthy enough in my body to physically do the things that I want to do with energy, with stamina, with limited aches and pains. And to me, that's prime health. It's quality, right? Because nobody wants to I don't want to live to be 95 if I'm bedridden in a nursing home, right? That is not prime health to me, right?
Yeah. Yeah. Well, thank you for sharing that. That's lifestyle versus health style is how you're capturing that. So that's great. Yeah. So Rita, thank you very much for being a guest on our show. I appreciate it. What you shared from 33 plus years of experience going through the healthcare gamut to now doing health coaching and really helping people with type 2 diabetes. So of course, you and I, we want this information to be shared, but I really speak to this, that if you're listening, whether you're a physician, clinician, someone in healthcare, or if you're a patient, and you heard something that could help one person, we just ask that you send this to that one person. They could then reach out to Rita and ask a question that could help them with their health, because we need to make, a change one person at a time. So we just ask if you could do that. Of course, I'd love it if you would subscribe to our podcast. We would love more people to see this. We can bring on more exciting and amazing guests for this. So as I wrap it up until next time, remember that true wellness is a journey we're all on together. Now, whether you're taking charge of your own health or guiding others in theirs, every step forward matters. I just ask that you stay committed to your Prime Health journey. And again, Rita, thank you very much for being a guest on the Prime Health podcast.
My absolute pleasure. Thank you so much for having me, Derek.